When I present my neurodevelopmental full-day seminar to physicians and other health providers, there's a module called Environmental Medicine and Children's Mental Health. That is by far the most sobering of the material that I present, because it's not pleasant for me to deliver and it's not pleasant for the audience to hear, especially about stuff that I've been looking into for years and years and they may be hearing for the first time, which is the association between neurodevelopmental disorders like ASD and ADHD and risk related to environmental exposure to chemicals, air pollutants, neurotoxic metals like lead and mercury. And the studies have been showing this more and more with respect to particulate matter or air pollutants with respect to the risk. So I think it's important for us to understand that a lot of times when these studies are done, the exposure levels are actually lower than what the current acceptable standards are, which is completely unacceptable. And then any study you read about toxic metals related to children will tell you that there's no safe level or no safe threshold for toxins like lead and mercury. And that's the sobering aspect of it, because we know that we're exposed and we know that they're exposed. In fact, some of the exposure is within the food that we feed to babies and infants, which is deeply, deeply disturbing. The percentage of foods tested that were found to be contaminated with heavy metals in good research studies was 94% of the foods tested. So that level of exposure is completely unacceptable. Obviously, we need to do something about that from a societal policy point of view, but also means that there's extra protective mechanisms that we need to build in to our protocols when it comes to the chronic care of such individuals, from both a nutrition perspective and an avoidance of chemical exposure perspective.